Dr. Guleria, may I please invite you on stage while Mr. Pereira reads your citation. Please, sir.
Dr. Randeep Guleria, Director of All India Institute of Medical Sciences, that we affectionately refer to as AIMS. We're always aiming higher. He is a distinguished pulmonologist and is credited with the establishment of India's first Center for Pulmonary Medicines and Sleep Disorders at AIMS. A visionary, a pioneer. Dr. Guleria is a global authority on immunization, on vaccination, and radiation medication. As a result, over the years, he has been invited by the World Health Organization, that we refer to as WHO, and the International Atomic Energy Agency to serve as a member for international studies as well as in advisory groups. In parallel, Dr. Guleria has been a member of several committees in India focusing on pandemic response, antibiotic resistance, virology research, and more, many more. Dr. Guleria has published over 400 papers in leading national and international journals. He is credited with pioneering work relating to chronic obstructive pulmonary disease, respiratory muscle function, lung cancer, and asthma. A researcher, an author, and authority. For his unique achievements, a young Dr. Guleria was recognized by the Government of India in 2015 with the Padma Shri. Currently, Dr. Guleria is a member sometimes technology overtakes us. Currently, Dr. Guleria is a member of the central government's National Task Force for COVID-19. This task force has been instrumental in formulating the government's response to the pandemic successfully. Concurrently, Dr. Guleria is a member of the Expert Advisory Group on Clinical Research for COVID-19 response, more specifically for vaccination and treatment. AIMS has been in the forefront of the COVID vaccination drive across the country, a proponent for vaccination for the elimination of COVID-19. Dr. Guleria has been advocating the vaccination of the entire Indian population. In addition, he is now part of the team advising the government on COVID-19 vaccination for children. Over the past 2 years, while the world has been battling with COVID-19 pandemic, Dr. Guleria has been the articulate voice of reason. First, treat COVID-19, a reaction. Thereafter, proactively prevent COVID-19. Dr. Guleria, an enlightened qualitatist. Dr. Guleria has become a familiar face on television. He always emphasizes the impact of COVID-19 on public health and education. He also alerts the viewers that the country should be prepared for similar pandemics in the future. Dr. Guleria is a COVID hero, or shall I say, a COVID superhero. Advocating every life matters, a crusader, respected globally. We are honored to present Dr. Randeep Guleria the Qimpro Medal 2021 for extraordinary achievement. May I request Dr. Ashok Agarwal and Roma Pereira Talwar to present the award to Dr. Randeep Guleria.
Thank you. Dr. Guleria, a few words, please.
Thank you. Good evening to everybody. Sri Suresh Lola, Managing Trustee of Qimpro Foundation, Shri Ashok Agarwal, Trustee, the various other trustees, founding members, my colleagues who have won the award, Dr. Bhandari, Dr. Chahal and Dr. Balram Bhargav, who is not here. Ladies and gentlemen, I am deeply honored and humbled at being conferred the prestigious Qimpro Medal 2021. I would like to take this opportunity to really thank the eminent trustees for considering me for this prestigious award. I know this is rarely given. This has been given, as was already mentioned, only 4 times before. And this is a highly coveted medal which is presented by the trustees of Qimpro Foundation to honor a benchmark leader for extraordinary achievement in a unique space. This year, unfortunately, that space has been the fight against a deadly virus that hit the world about 2 years ago, COVID-19. A novel virus to which humans had no protection jumped species and developed the ability to have sustained human-to-human spread, and this spread like wildfire and caused more than 5 million deaths. We witnessed an unprecedented crisis which affected every strata of life, not only health, but also economy, livelihoods, social fabric, governance, security, and humanitarian needs all became an issue during this devastating pandemic. The entire economic system was shaken to the core. We all experienced how this COVID pandemic caused an unrepairable damage to thousands of families. I think there's hardly any family which has not been affected by this pandemic. Doctors across the country have worked tirelessly all through the pandemic and saved millions of lives. We were initially trying to face an unknown enemy with medicines whose efficacy was not known. COVID management required a lot of operational management and planning. We at All India Institute of Medical Sciences, all the faculty, staff and administration joined hands and through early planning and implementation created more than 1,700 beds in our hospital with all necessary infrastructure for COVID management. We would meet every day in the morning, 8 to 8:30 for maybe an hour, sometimes even 2 or 3 hours. Our faculty, our residents, our nursing officers, our technicians and other staff and discuss daily issues encountered while taking care of patients. Every day we had new challenges and new issues. But as a team, we sorted all these problems, ranging from shortage of PPEs in the early days of the pandemic, and we actually did a research project where we tried to see and actually published that we could recycle PPEs. If we had a shortage, we could take our PPEs and recycle them, and that could actually also lead to less wastage of plastics. Fear among the staff, that was another major challenge. I remember in the early days of spending almost 2 hours with the staff nurse who refused to go home because she thought she had come in close contact with a COVID positive patient, and if she went home she would give the infection to her parents, and wanted to stay in the hospital till she was tested
took us a long time to reassure her that that was not how she would get the infection. We had challenges like creating a labor room overnight because one of our residents' wife who was expecting became COVID positive and went into labor. We had to increase our diagnostic facilities because of the huge surge of cases and the load in the emergency department. And this was a challenging time for all of us. We also helped in national issues. AIMS New Delhi has been in the forefront of policy making and treatment guidelines for COVID-19 management. We, along with the ICMR, developed mentorship programs for enhancing the RT-PCR testing for the country. We held multiple meetings and made sure that every government and private medical college had the capacity to do RT-PCR. After that, we started looking at veterinary colleges and other colleges or other universities which could do RT-PCR testing. And from a handful of labs, we have now more than 2,500 labs which can do testing for our RT-PCR and have the capacity to do more than 2 million tests a day. AIMS also developed an eICU program with the Ministry of Health and Family Welfare to interact with hospitals all over the country to provide support to the doctors for treating sick patients. I personally interacted with more than 550 hospitals, and this also helped me gain insight into the challenges faced by doctors in different parts of the country. The selfless work done by the doctors really made me feel proud. This is why we choose this profession. I remember in one of the eICU discussions, a doctor who, while discussing COVID-19 management, told me that he was actually a gynecologist and was running a private nursing home for gynecological and services and deliveries. He had never before managed critically ill patients with respiratory problems. Yet now he was wearing PPEs and managing sick patients in his ICU, which was meant for post-op cases and for deliveries. This made me realize the need to train healthcare workers in patient-oriented manner, and this resulted in us initiating our weekly national grand rounds, which were very popular and became case-oriented. In collaboration with the Health Ministry, we also helped create mentorship centers of excellence in all states and regions for COVID management. Web-based training modules were also developed for doctors, nurses, and public. With the support of the Government of India, AIMS became the model and a guidance center for Medical Institutes of India to fight the pandemic. This was really a challenging time. However, we saw a lot of suffering like never before. I remember an incident of a very close childhood friend of mine. The couple grew up at the AIMS campus. Their parents were doctors at AIMS. They fell in love and got married. And since the beginning of the pandemic, my friend would often ring me up and ask me about COVID-19. And I would often reassure him and tell him that more than 80% of patients will recover or not require hospitalization, and the mortality is less than 2%. During the dark phase, first him, then his wife, mother and daughter all got caught in COVID-19 infection. Unfortunately, both his mother and wife passed away. When I talked to him a few days later, he cried bitterly and told me that contrary to my data of 2%, for his family, the mortality was 50%. For families that lost their near and dear ones, statistics didn't matter. In another case that I can never forget, an old patient of mine with bad asthma and severe arthritis developed COVID. She was in her 70s and wheelchair bound because of severe hip and knee arthritis. In the night, her saturation fell to 70%. Oxygen was given with the help of cylinders, and I advised her to come to our emergency department for admission. This was during the peak of the second wave, and I actually arranged for a bed for her also. Because of her arthritis, she could not come in her own way car, and her husband tried desperately to get an ambulance in the middle of the night. He even approached the nearby hospital, but sadly that was not possible. They tried all night long, and finally in the early hours of the morning, the family shifted her to the drawing room. They sat around her and chanted prayers, and she passed away with the family around her. These were the challenging times that we had to face. But during this time, our doctors showed remarkable courage all through this period. One of our residents, while shifting a sick patient on a ventilator from the casualty to the trauma center, which was our AIMS COVID hospital, noticed that the breathing tube had come out. He removed his headgear, exposing himself to the infection, and re-intubated the patient in the ambulance. Had he not done that, the patient would have died there and then. We saw a lot of fear and associated stigma also with the pandemic. One of my doctors, who's a resident, and he told me this story that he stays on the 5th floor in a rented room in Gautam Nagar, which is just next to AIMS. And he told me that every night when he goes home after doing his duty in the COVID ward, the landlord would lock the lift door because he was scared that if this doctor who was working in a COVID area entered the lift, he also could get infected with COVID. So every day after his COVID duty, he would climb 5 floors, but he had no complaints and said it was a good exercise. So this was the type of positive attitude that we saw amongst our doctors. But we also saw a lot of courage amongst our patients. I remember one patient who told me that don't worry, I will recover. He became very sick. He was on a ventilator for months, and I had lost all hope as to follow him up very regularly. Yet he came out and met me a few months later. His voice was hoarse due to the tube that had been there in his mouth and the airways to support his breathing. He smiled and told me that, remember, I told you that I'll be back. So there was a lot of positive attitude also. All these extraordinary experiences helped me understand that medicine is an amalgam of both science and spirituality. As we progress towards scientific advancement, we must not lose touch with faith and empathy as we care for our patients. As I conclude, I thank God Almighty for giving me this opportunity to serve humanity and help my fellow citizens in whatever way I could. I thank my family for the love and unstinted support. My wife is also a doctor. She also worked in a COVID hospital. My son is also a doctor. He also works in a COVID hospital. And so is my daughter-in-law. And there were many days that we would eat in different rooms because one of us had come in contact with the COVID positive patients. There were weeks when we slept in different rooms because we didn't want to give infection to others. So I really thank them for all the support because I could not have been able to fulfill my duties without their support. As I accept this medal, I dedicate it to all the doctors, healthcare workers, frontline workers, and every citizen of our country who came forward to help in whatever way he could. From ordinary people, they became extraordinary COVID warriors. We could not win this war, and we will not win this war without everyone's support. Thank you. Jai Hind.